Okay, now we're going to test for scapular adduction or the middle trap. The rhomboid major also do some scapular adduction. And now the patient is going to be in the prone position, arm at 90 degrees for the glenohumeral joint, and what we're looking for again is for that scapula to move in an adducted manner. Okay, so what you want them to do is complete the available range without any manual resistance. First is going to be a grade 3, so I want you to try to lift that up and put that back down now for me. Now what I'm feeling for again is making sure that scapula adducts. So go ahead and, yep, and the scapula definitely goes through that full range of motion. Okay, and what I'm going to do now is apply the resistance always at the distal humerus. So go ahead and lift that up again for me. Hold that, don't let me move you. And what I felt for there is again, we're applying the resistance here, but we're feeling for the yielding happening at the scapula. Okay, she did have an actual little bit of a yield here, but it was because of the posterior deltoid weakness, possibly here. So if they have significant posterior deltoid weakness, you can also apply the resistance here, so it's a shorter lever arm. So go ahead and lift that up again as you did. Hold that, don't let me move you. Okay. The scapula still did yield a little bit, even though the glenohumeral joint did not yield. So I would actually give that a grade 4 because it did yield. It moved into scapular abduction. So we know that she is a grade 4 for that, but a grade 5 it would hold strong. Now when applying counter pressure over that opposite side when you're completing these grades 3 through 5, so you help prevent against rotation of that thoracic spine. Now grade 2 is you as a therapist is going to be stabilizing, or excuse me, not stabilizing, but cradling the arm. And again, you're going to be feeling for full range of motion at that scapula. So you're going to pull them into horizontal abduction of the glenohumeral joint. And what you're feeling for is that scapula adduction. Okay, making sure those middle trap fibers are working there. Okay, and what I want you to do now is trying to hold that position there. Okay, hold that position and then relax. Now what I'm trying to feel for here is an actual muscle contraction at that middle trap. Okay, so again, to show you again that they don't have the weight of the arm, you're cradling, and you kind of give them a little bit of assistance. So go ahead and try and bring your shoulder up off. There you go. And again, you're feeling for that contractile activity. For a grade 2, you're making sure that is going into adduction. And then a grade 1 is your, okay, hold that. You're feeling for contraction at that middle trap without any, if there's no motion happening at the scapula, it's going to be a grade 1, and of course a grade 0 is going to be no contractile activity.